and follow along. All right, so we're being recorded. Thank you. Next slide, please. Hi, my name's Emma Oppenheim. I'm the Medicaid Transformation Project Director. Work quite a bit on reentry and our second webinar, or our third webinar, I believe, on MCO contracting and credentialing. And let's just keep going. Next slide, please. And Lindsay just put the link to the slides into chat, so you might want to check that out. And we're going to try to leave some time at the end for Q&A. So again, put your questions into chat. We'll try to answer them as we receive them, but we'll be doing verbal responses towards the end. And then one other note is that we do not permit AI note-taking applications. So if you're using something like that, we ask that you please don't. And I don't think I'm seeing any of that. So I think we're good there. Next slide, please. All right, so we have many partners today to help us with this presentation. We have representatives from our managed care organizations. We're going to help us with content, and we're going to do another program requirements overview. We did this in our last webinar. Then we're going to transition over to our managed care friends. They're going to talk about some background on MCOs. They're going to talk through credentialing requirements, the contracting process, and then we're going to transition into Q&A. So next slide, please. All right, program requirements. Next slide. You probably remember this from last time. Our little milestone chart got a bit of a refresh. So we are really talking about milestone 2 today, the capacity building application attestations, our program requirements, and how they play into milestone 3, our readiness assessment. So we need to make sure that we can meet all those milestone 2 requirements so that we can explain how we're meeting them for milestone 3. And we're just trying to set everybody up for success. That's the goal of these webinars. And let's keep going. I'm going to go through this a little bit more quickly than I did last time. Oh, next, thank you. So a lot of content here. I won't go through it in as much detail today, but the important thing to know is that milestone 2 of the capacity building application, every attestation is a requirement for the program. And then again, for that milestone 3, for that readiness assessment, which is yet to be released, we're targeting around a March release for that material. We're going to be asking facilities to describe how they.
Emma,
Oh, yes.
I'm sorry. We're getting a whole lot, at least I am getting a whole lot of feedback because microphones are on, I think.
Thank you. Thank you. Let's just do a quick, could everybody just do a quick check of their mic and their microphone?
I'm going through and muting them as well.
Okay. Seems quieter. I think I got muted too. All right, thank you. So, and thank you to everybody. I'm sorry we had a snafu with the Teams link. So I think we might have new folks here. If you haven't missed anything, we're just going through that same, what is milestone 2? What is milestone 3? Let's move on to the next slide, please. All right, great. So where are we today? What are we talking about today? MCO contracting and credentialing. And if you refer to your capacity building application, Section 4, which is the section on provider enrollment and billing, we're specifically talking today about questions 2 and 3, which are about MCO contracting and credentialing. Next slide, please. All right. And just a plug to keep coming to our learning webinar series. It's so important. You'll learn so much here. And we will be doing our webinar next week on client eligibility and enrollment, as well as the Consolidated Appropriations Act benefits for youth, which you might have heard about. And each of these learning webinars coordinates with the release of a section of what we're calling the Policy and Operations Guide. And so the first 3 in the new year, we're going to be releasing those sections in January. Next slide, please. And just really hitting the nail on the head here. Question 2 and question 3 are credentialing and then contracting. So we're in capacity building application section 4, and today we're talking about questions 2 and 3. And I think that's all from me today. So I'm going to turn things over to our MCO friends. Thanks, everybody. Hope this is really helpful.
Hi, good morning. My name is Kathleen Boyle. I'm with WellPoint. Let's go to the next slide. First, I just want to have each of the presenters from the MCOs to introduce themselves. If they can pop on camera, I'll call you out just so you can put a face to the name, and then we'll be on camera when we're actually presenting. So let's start with our presenter from Community Health Plan of Washington. Oh, are you there? I think you're muted.
Well, it should be Dorothy Harden. This is Cindy from CHPW. So I'm not presenting, but let me find out where she is. I'm so sorry.
Okay. How about Melina?
Yes, good morning. My name is Carrie Fredette. I'm a Director of Provider Contracting with Molina Healthcare of Washington. I'll just give you a quick couple of facts about Molina. We serve Medicaid members in every county across the state. We're proud to be both the largest payer in the state and the #1 MCO for quality and member choice. I want to thank everybody for joining today and for partnering with us on the Reentry Initiative. Thank you.
Thanks, Carrie. Coordinated care.
Good morning, everyone. My name is Bree Elsie, and I'm the Justice Systems Manager here at Coordinated Care. It's nice to see you all this morning. I'm looking forward to giving you some information.
Great, thank you. And United?
Good morning, everyone. My name is Freddie Campbell, Senior Clinical Program Manager with United Healthcare. I oversee our jail transitions and criminal justice program. Thank you.
Great, thank you. And finally, Kathleen Boyle again from WellPoint. I'm our Director of Justice and Allied Systems, overseeing all of our work statewide with carceral facilities. Many of us you may already know. So thank you, everyone, for saying hello this morning. Let's go to the next slide. So what are our functions? Part of, many of you may hear some of this information. It may be repetitive to you as we've met with a lot of you, but we definitely want to make sure that we're covering it for everyone. So our core functions are supporting our members and supporting our providers. So our managed care is basically a system of medical management programs in which patients, purchasers, administrators, and providers, we're all linked together. How we support our members is through care coordination, and we do that with you all right now in a lot of ways. Every MCO has a team that is trained to support members and healthcare needs and social needs. That might be through a clinical case manager, by a nurse or a social worker or a mental health professional. It could be a community health worker, could be a peer support person. We also maintain a network of providers to make sure that our members are able to access care close to their homes and in an easy fashion. We also provide member education, including things like making sure members understand what their benefits are with us and what additional benefits that we can provide. We'll also help them understand different community resources that they may have. And we ensure that they have quality interventions. We want to make sure that our members are receiving high quality care and also receiving high quality preventative services. In addition to supporting our members, we also support our providers and community partners. We partner with our providers to ensure that there's smooth transitions from one level of care to another, and making sure that we're helping them identify community resources or accessing community resources for our members. Obviously, we contract with all of our providers to provide medical care and physical health care, mental health care, and substance use disorder treatment for all of our Medicaid members. We want to ensure that all of our providers are credentialed, and we're going to talk a little bit about that today. Each provider does need to be credentialed with each MCO to make sure that you're able to care for our Medicaid members. It's our responsibility to pay your claims for Medicaid services and pay those timely. We also like to provide data to our providers and community partners and other resources just to make sure that we're all working well together. Let's jump to the next slide, please. So how do we partner with the carceral facilities? As you know, we all partner with you now in many ways. Some of you have us come on site. Some of us, we share information with you back and forth. But in terms of the waiver portion, this is how the MCOs and the carceral facilities will be partnering together. So we will be partnering with you to support targeted reentry services. We'll also contract with carceral providers to pay for the waiver services. We want to support the reentry activities to prepare our clients for a successful transition into their communities, and also address any barriers that they have in accessing care, coordinating with community partners, and making sure that we're providing ongoing support as needed once they have released from your care. And I'm going to hand it off to Melina to talk a little bit more about the next portion. Thank you.
Thank you, Kathleen. So the MCO contracting process overview. The next slide, please. Thank you. To help illustrate the standard process, we work together to create a slide that provides a visual of the contracting decision tree. There are actually 2 distinct tracks that will guide how carceral facilities and community providers progress through the credentialing and contracting process with managed care organizations, or MCOs. I'll walk through the details of both tracks. Starting with track A, which is the one highlighted in blue, we have carceral facilities who will be utilizing community providers. These providers will be providers such as mental health providers, sub-providers, and federally qualified health centers who are providing services to eligible individuals. For this track, the carceral facility will work with the MCO to complete a Memorandum of Understanding, or MOU. And this is the one along the top you're going to see. The MOU is a non-financial partnership agreement, which is actually going to be covered in more detail on the next slide. Once the MOU is completed, the carceral facility MCO contracting process is finalized. The second part of track A, which is right down the middle of the slide, applies to community providers who will credential and contract directly with the MCO. For these providers, the process includes completing the MCO credentialing application and signing a provider services agreement, or the PSA. Once these steps are completed, the community providers would be fully credentialed and contracted with the MCO. I do want to call out that there's a little bit of a caveat here that if a community provider is already contracted with the MCO, an update to their existing contract may be needed to align with the requirements for this process. This is something we will assess in our discussions with each provider. So now looking at track B, which is that bottom one that is green, this track focuses on carceral facilities with employed providers. This track applies to carceral facilities who will have their clinician employees delivering services. This may be medication management, mental health therapy, clinical case management. These services will be, of course, supplied to eligible members. For this track, the carceral facility will complete both the MCO credentialing application and a provider services agreement. Upon completion of both of these steps, the carceral facility will be credentialed and contracted. I want to note that in some scenarios, there may be a combination of track A and track B. For example, a carceral facility might use both community providers and employed providers, requiring both tracks to be completed to ensure all parties are appropriately credentialed and contracted. Lastly, just to be aware, as we move forward, the same process is going to be applied to all additional cohorts, no changes. I'm now going to turn it over, I believe, to Kathleen to review the MOUs.
Great, sure thing. So memorandum of understanding. Let me just start by saying some of you have MOUs with us currently, and those may need to be updated, or we may need to do a separate one altogether. But our memorandum of understandings or MOUs they're an agreement or for partnership that don't involve financial arrangements. So there's no money exchanged and claims paid and things like that when we have a memorandum of understanding. It's basically how we agree to work together. It describes the roles and responsibilities of each party in the agreement, and this helps us collaborate with you and work with the carceral facilities to improve integration of physical, mental health, SUD, and social needs for all of the Medicaid enrollees. And so some of the things that an MOU could include are processes for sharing enrollment access, authorizations, eligibility, different things like that. It also talks about how we're going to share systems issues with each other and identify system issues together and address them. It also could identify joint training needs where in the MOU we could work together, we could agree to work together to identify where we might both have identical training needs. And it can also include a process for escalation of concerns. So just a kind of written out way of, if you can't get a hold of this person, or if this is an issue, then this is your point of escalation within the MCO. So each of the MCOs will have our own MOU template, just because we each have our own kind of different requirements around the MOUs that need to be executed. And so we will work with the carceral facilities to do those MOUs as needed, and or update ones that we currently have with you, as we do have with several. And back to Carrie for the next slide.
Thank you. As you may recall from the decision tree, both Track A and Track B require a provider services agreement. In Track A, the community providers will be responsible for completing the agreement, while in Track B, the carceral facility will complete the agreement on behalf of its employed providers. The provider services agreement serves as a foundation of the relationship between the provider entity and the MCO. It defines the critical aspects, such as the obligations, the compensation, and expectations of both parties, while also providing references to policies and procedures. A contract specialist will help guide providers through the entire process, from initiation to full execution, ensuring clarity and compliance along the way. While contracting can sometimes be completed in as quickly as 30 days, it's important to note that timelines may vary depending on the specific circumstances. Additionally, I do want to call out that MCOs must adhere to regulatory requirements from the healthcare authority and other entities. As such, we are unable to use a contract developed by a carceral facility. Instead, we must use our documents that have been vetted and approved. Each PSA will be unique to the specific provider and MCO. There will not be a shared template across MCOs. This process ensures that all agreements will meet regulatory standards. So again, you're going to need to have a different PSA for each MCO. I will now turn it over to Bree with Coordinated Care to review credentialing.
Good morning, everyone, and thank you, Carrie. So yes, I'll be reviewing a couple slides in consideration to the credentialing process. So next slide, please. So this process will only be required if you employ providers within your facility who will directly deliver services to Medicaid enrolled members. Credentialing is a method of verifying that healthcare professionals and facilities are certified and licensed, and this process is multi-stepped and can take up to 90 days to complete. Following the receipt of your application, an MCO credentialing specialist will reach out to let you know if anything is missing or if additional information is needed. And you can speed up this process with the credentialing if you submit a complete, accurate, and signed application the first time. Make sure that you attach all relevant documents to your application and that they are also current. Upon successful completion of the credentialing, an MCO will then reach out to move forward with the contracting portion. So credentialing comes first, and then you move on to the contracting portion after the fact. And how to start the process is you want to complete the MCO credentialing application and provide the requested documents such as the current licenses, and you must be licensed in Washington State, the current liability insurance, most recent survey, W-9 forms, roster list of locations as well. Next slide, please. All right, just some need to know and good to know information here. So the credentialing is critical, is a critical step to ensure go live readiness and is initiated by provider entities, so by the jails themselves, the facilities themselves. Failure to complete credentialing early may result in downstream delays to portal access, provider loading into MCO systems, and claims testing and payments. Credentialing applications must include each license location, and then the new locations as well must be credentialed by the MCOs, with the MCOs in a timely manner. And if any of those locations close as well, the MCOs need to be notified. And I believe after that, I'll be passing on to Freddie for the contact information.
Thank you, Bree. So this is a very important slide. So this slide has all of our MCO contracting and credentialing information. So this is how each of the MCOs can be reached to begin the contracting and credentialing process. This information will be posted and shared for all of the facilities to be able to obtain. So we can go ahead and go to the next slide. So for next steps, the MCOs will continue to connect and reach out to all of the facilities to confirm the providers for reentry services. So many of you in cohort 1, you've already been receiving communication from us to see who you're using for reentry services. So that process will continue. MCOs will then outreach the facilities and the identified service providers individually to begin the contracting process. Then, as such, the contracting is unique to each MCO. So, facilities will then meet with each MCO and the MCO independently to complete the contracting process. However, MCOs will continue to work collaboratively to educate and support the facilities in implementation efforts. With that, I think we'll turn it back over to the HCA.
Thank you so much. So we definitely are seeing some questions in chat and we're going to go through them. And then just another reminder that you can send questions to our reentry inbox. And I'll do a very selfish plug on this. Sometimes people email me directly, other folks on the team directly. You'll probably get a faster response if you email the reentry inbox. So we do just recommend that you send your questions that way. All right, next slide, please. Oh, sorry, maybe back one. Apologies. All right, I think we can go and just go through the questions.
Yeah, let's start with some questions. So it looks like this one may have been answered directly, but the first one is, are the MOUs intended to be non-binding? I typically try to avoid the use of MOUs in circumstances where the parties intend to be bound by the terms.
And I'll turn things over to an MCO presenter to answer that question. Or we can also take questions back, just flagging that.
Sure thing. I typed a response in there, but thanks. So the MOUs are really meant to be a partnership agreement. If the one piece about it is it allows us to do some additional communication around the members, but what each of us want to do is make sure that you're comfortable with the MOUs. And so if you're feeling like the terms in there are not acceptable, we want to have that discussion with you and find terms that you find to be acceptable. The next question that's right below it, I'll just jump on it while I'm I'm talking is around why is there 5 different MOUs and not a single template. So each of us has our own legal teams, just like each city and county has their own legal teams. And each one of them do have kind of different necessarily opinions about what all needs to be in an MOU or what can be left out of an MOU. And so we don't have a universal template, but that's why each of us will work with you to make sure that you have something there that you're comfortable with, and work with our legal teams as well. I know Dorothy was able to get off mute and she was going to present that slide, or if any other MCOs want to add to what I said.
No, thank you for covering that.
Thank you. We'll go to the next one. So the next one is, will carceral facilities bill services provided prior to release to the MCO or directly to Apple Health fee-for-service?
Yes, I'll take that question, and then I think let's turn things over to Sean Davis, who has his hand up. But so question about billing services. So you would be billing prior to release. Yeah, that's the goal of this program, is to be able to bill for healthcare services prior to release. We'll be talking more about who you bill next week. So if it's an MCO enrolled individual, you would be billing the MCOs. If it's a fee-for-service person, you'd be billing Apple Health. And more to come on eligibility and enrollment next week. Hope that helps. All right, I see a question, a hand raised.
Quick question. So I'm trying to wrap my head around this because I've missed a couple meetings. So I need to get 5 MOUs with each one of the MCOs. Credentialing, I need to initiate for my doctor that I contract with that comes down once a week. I get that. What about if I have to take, because we're limited in what we can do in the facility. I'm a small jail. So my doctor comes down once a week. He can do certain things, but then there are a lot of times we've got to go to the hospital, or we've got to go find a heart specialist in Spokane or another specialist somewhere else. Are they all going to be already, the hospitals and stuff, signed up for this? So when we bring somebody in from a jail, they can bill directly? Or are they going to be sending me a bill and then I have to bill? Or are there any different avenues that have to take place for when we have to do those type of things and leave our facility and go to all these other places?
Yeah, I'm going to try to take a stab at this, and then maybe I can turn things over to the MCO. So I think
I
appreciate
see
the
Michael
feedback.
laughing.
Oh, sorry. So appreciate the feedback. I think we definitely appreciate the fact that it's, a heavy lift to do all this startup paperwork for sure. If you're working with a community-based provider, especially a hospital system, so community-based providers should already be contracted, credentialed for the most part with our MCOs. You would need to check for an individual what MCO they have and whether an individual community partner has a billing, contracting, credentialing relationship with an individual MCO, but that work should largely already be done. And then probably forgetting the third part. So would love to turn things over to an MCO contact too.
Because I have
Sure.
one hospital. That's it. I can't, the next hospital's an hour and a half away. So I'm going to this one. And I need to know if everybody's going to be okay to go there. And then if they send off for further tests for a heart specialist down in Spokane or something like that, somebody's got a bad enough crime. We're not letting them go. So we're going to be taking them to these kind of things. And it happens way more often than I would like. So I'm trying to see how this works with those scenarios.
I would just check with the MCOs if that facility is enrolled, but likely I'm assuming that it is, although I don't want to speak for anybody. Anyone on the MCO team want to step in here?
Hi, Emma. This is Carrie with Melina. And I think if you look at the slide that has that contracting decision tree, we're hopeful that that can help provide some clarity. It sounds like you're talking about potentially a combination of tracks. So track A, right, has that MCO giving you the MOU, which is where you would not be billing. but you would be utilizing community providers. So with track A, those community providers would be billing us directly. A hospital is going to fall in track A. They potentially and probably already have a contract with us. But in our conversations with each of the carceral facilities, we will be finding out which providers you are utilizing, and we will be confirming their status. So we will be confirming if they are already contracted or if we need to reach out to them to extend a contract. That is part of this process for track A. Then track B is going to be potentially if you have a provider coming into your carceral facility. Sorry, I apologize. Track B is if you have an employed provider. So if you are actually employing somebody and they work within the carceral facility.
Okay, so I have a contract with an outside doctor who runs his own clinic to come in and do once weekly med call. So I'll be using whatever track that is, along with track A for hospitals and stuff like that as well. Now, the credentialing side of things, that's a one-time thing. So the doctor I contract with just submits that once, or does he have to credential and submit that to all 5 MCOs?
It is going to be to all 5 MCOs. We will have separate credentialing processes. It is potentially that this provider is already, again, credentialed and contracted with us. We can vet that for you.
Okay. That's all I got for now.
I just wanted to add real quick. First of all, Sean, thank you for the question. And Carrie and everybody from the MCOs that we're working with here today, they are experts in this area. So we work with them a lot. So I realize there's 5, but I think they know how to work this process. I just really want to mention that before we leave the call.
And Emma, this is Kathleen with WellPoint. And just before we go on to the next questions, and I know there's plenty, and I will absolutely echo what Michael said. We are here to work with you. And we work really well together, the 5 MCOs. While I know in some ways we're competitors, in this process, we work very well together and have for many years. And so we will make sure that you're able to we can make this as smooth as possible. What I am seeing is a lot of folks on the call from carceral facilities that we haven't seen the names before, or they're not on our contact lists. If folks could just put your name and your email and or phone number in the chat, that would be super helpful. Just so we know too, if we're reaching out to you after this meeting, or if there's questions that we want to follow up with, if folks could please let us know. We want to make sure we're contacting the right people and getting your emails correct or your phone numbers correct. Thank you so much. And I know we have questions.
Yeah, going back to one of the first questions, though, the only question that wasn't answered was, do we have to wait to go live until we are contracted with all 5 MCOs?
It is a program requirement that we're contracted with our MCOs. So I think, well, we can address this as part of the readiness assessment, but we would need to see progress towards being contracted. And we can answer questions like that on an individual basis with facilities as part of our back and forth for the readiness assessment. I was just asked, I'll just, one other quick thing. So I was just asked to reiterate, a community-based provider that you work with should probably already be contracted, credentialed with MCOs, I'll just say broadly. You do need to make sure that they are reaching out, that community-based provider is reaching out to their MCO contracts to be able to revisit the contract that they have with those MCOs to provide care for these reentry individuals. So just good to know sort of the network of providers that you work with and make sure that everyone is just doing a double check of their contracts with each MCO. And Siobhan, if you want to step in here and add anything, please feel free.
Oh, sure. Thank you. I just, not to add a lot of complexity, and I think this is probably more for things like reentry case management, things that are new that we do need to make sure that the services that they're providing to your incarcerated individuals are within the reentry space are services that they're contracted to provide. So just because they have initial contract with us doesn't mean that they can provide every service. We just need to double check what services are they providing. Is that already in their contract? Do we need to make adjustments? That kind of thing.
Thank you.
And Emma and Mariah, Michael Arnes here with Healthcare Authority again. Hey, I just wanted to let George from Skagit County know that if we did not answer your question about go live, please feel free to type in an additional amendment to the question. I'm looking at it. It says, do we have to wait till go live to contract with all MCOs? You can begin contracting now, as Emma and all the MCO reps have been talking about. We don't have to wait until the go live date to do that, if that's what your question is referring to. But please feel free to clarify for us if we're not answering correctly.
Got a follow-up question. How can credentialing take place before contracting when credentialing was waived for 12 months before go live?
So I'm wondering, Arthur, Colette, some other HCA folks who are on the line today, do we need to take that question back and share a written response? Because I know we had talked about that policy, and are there questions about it?
Yeah, I think we should take that question back.
Thank you for the clarification. So we're so sorry about this. We had talked about a policy for facility-based providers only, so not for community-based providers who, again, likely already are contracted and credentialed for the most part, but for our in-facility providers. And we're going to take that question back and share a response in writing. Thank you, Arthur.
Emma, the pace of the questions seems to be slowing down some, so I just wanted to put in a plug for the billing webinar as well that you did a few minutes ago. I think that'll give us a good chance to deal with all of the billing questions at once. And just as a reminder to people that we are at the Healthcare Authority going through a solicitation process for a third-party administrator, and we can talk about the role of that third-party administrator when we go through that particular webinar on billing. So just again, another reinforcing Emma's plug to please attend that webinar as well.
And this is Kathleen with WellPoint again, and just thank you everyone for putting your emails and your contacts in the chat. We can reach out. I know many of you may not know that we've already reached out to folks at your facility, but it may not be you who was identified as the contact person. So we will take this list, and the MCOs, how we've been doing this process is we kind of divide them up amongst ourselves. So you don't have 5 MCOs calling you saying, hey, let's talk. And so with these email addresses and stuff, you may start to get an email from us. If you haven't already had a meeting with us, or if you'd like to have another meeting with us, you can, where we will sit down, and then they'll pull the rest of the MCOs to that meeting so that we can talk all of us together and make it a simple process for all of you. So if you haven't been a part of those meetings, please let us know. Or if we need another meeting, you can put it in the chat, or just give us just shoot us something. We're happy to do that. But thank you so much for providing that, because I'm seeing lots of names here that aren't on the list of who we originally contacted. So we greatly appreciate it.
Thank you, and we'll help facilitate that.
Another follow-up question in the chat. Could HCA introduce the reentry targeted case management billable services, and how community providers along with carceral facilities will be able to bill for this service? or will this be addressed in an upcoming webinar?
Yeah, thank you so much for that question. That's a really important, great question. And I'm looking at this list of webinars and I can see why it's not clear. So we'll be talking in more detail about our services during that pre-release services delivery webinar, which is on Wednesday, February 5th. And so we really highly recommend that your care coordinator staff, your clinical staff are in that webinar to learn more about that service.
And Emma, just in case I don't get I'm trying to copy and paste all the emails out of the chat. I won't have access once we stop the call. Can HCA copy these and send them over to us?
Yes, put a finer point on that. We are capturing everybody's email address, everyone's name, and we're going to send it. We're going to pull them all together and send things over to the MCOs. I think maybe we can also touch base offline about a sync up of our contact list because we should have a lot of these folks. I'm looking at these names and feel like they seem familiar.
Yeah, I'm trying to compare them to our inventory list at the same time, and there's some there, some not. So that's great. Thank you.
Fair enough. Thank you. All right. Mariah, any other questions? Does anyone else have a question and want to raise their hand and ask something?
Doesn't look like we've got any other questions in the chat.
All right. So I'll just do another quick plug for, we really appreciate your attendance today. I think it's definitely a lot of content. Please take a more close look at the deck and feel free to email us with more questions. And then next week, we'll be doing client eligibility and enrollment, which will basically include who do you bill and when. And so more to come. Thank you all. We're here if you have more questions. So thanks so much, everybody.
Thank you, Emma.
Thanks, guys.
Thank you.